It's a true honor to have the opportunity to kick off the Leading Health Indicators webinar series as we are this morning. I'm joined today, as you indicated, by Kim Hobson, who's our Executive Director for the Collaborative, along with Alana Kaufman, who is our extraordinary data manager and data analyst, who has helped us understand so much better the successes and accomplishments that we are seeing with the programs of the Collaborative. Next slide. You could go back one. Thank you. So the Southside Healthcare Collaborative is a program of the Urban Health Initiative. And the Urban Health Initiative is a collaboration with the University of Chicago and the communities that make up the south side of Chicago. As you can see from the map, the University of Chicago sits in those communities, and we are trying to work together in order to create a system of care that allows patients to be seen at the right time in the right location for the right reasons. And our goal is to try and make the south side of Chicago a model of urban health by 2025. Under the auspices of the Urban Health Initiative, one of our first programs was the creation of the Southside Healthcare Collaborative in partnership with our community partners. Next slide. As Mr. Munson mentioned, we were established in 2005, and at that time we were a relatively small collaborative that now has grown to include 30 federally qualified health centers, free clinics, and safety net hospitals. We represent, as a collaborative, many of the healthcare needs of the south side of Chicago, and we advocate on behalf of the population. One of our main goals is to bring people into care, and as you indicated, that aligns very nicely with the leading health indicators of trying to ensure that there's access to service as part of the 2012 goals, rather 2020 goals. Next slide. So we are building ongoing relationships between Southside residents and the providers that provide primary care, as well as those that are providing subspecialty care for this very needy population. We are focusing on wellness, routine care, and prevention, as well as prevention of diseases and building a network that will meet primary care and subspecialty care needs. The map shows the sites that are distributed across the south side. The two at the bottom of the map include some of the suburban areas of the south side. What we've shown on the map is the greater Chicagoland area with specifically the south side communities, the 34 communities that make it up, as we have defined the south side, shown in yellow. Next slide. Our Medical Homes Connection program is designed to connect residents to community health centers and to providers in order to receive the array of services that, generally speaking, are provided in a primary care setting. And we are linked to federally qualified health centers in particular because of the large number of people living in poverty representing the south side of Chicago. South side of Chicago is a very vibrant community and is represented by all stratas of socioeconomic levels. But we do have a large number of patients who are in need of services that are provided through the FQHC system. And so we're very thankful to have this large number of partners that are interested in working with us to try and meet the needs of the population. Next slide. As part of our program, what we chose to do was set up a patient advocate system, which is our Community Connections program, and they work with patients who come into the emergency room who are in need of a primary care medical home. We educate patients on the value of community clinics. We share information about those resources, and we connect patients to services, including both primary care as well as subspecialty care. Next slide. Our advocates are not there around the clock. You can see the hours that they are posted as well as the days of week that they work, and they're split between our adult ER and our pediatric ER. Those ERs are in adjacent buildings. In fact, they're across the street from each other. And we're fortunate at the University of Chicago to have a freestanding children's hospital in addition to our adult hospital. The patients who come in during those hours that the patient advocates are in place will have the opportunity to be seen by an advocate, and the patients are connected to those advocates through either the direction of the ER physician or based on the acuity that the patient has when they're assessed at the time of entry into the emergency room. If patients need those services in hours that the patient advocates are not posted, then there's follow-up through the advocates the next morning. Next slide. You'll see the number of patients that have been contacted through the program, the number of appointments made, and the number of approaches by the patient advocates. The percent represents then the show rate, which is our ability to be able to have made that appointment and then followed through and determined whether or not the patient came. Of course, we're not happy with that show rate. We would love to see it higher, but it is in keeping with the kind of follow-up rate that's seen with emergency rooms that are similar to our own, working with a high-risk population such as those using services and using our ER often for what could be handled by a primary care medical home. Next slide. Oh, wait a minute. Could you come back to that slide just for one moment? I just want to point out that the number of advocates has varied over the course of the program, and of course just shows one of the challenges that any program like this has, which is to try and ensure that we have a steady funding over the course of the programming.